Fresno State has one of the top nursing programs in the country, providing students with the latest in technology. In tonight's Education Matters, Juanita Stevenson joins us with how instructors are giving students the opportunity to connect with the community and patients. Juanita.
The mobile health unit takes nursing students out into the community where they are not only getting hands-on training with a diversity of patients, they're learning something technology cannot teach: compassion.
Hi, Christine. I'm Amy. I'm Cynthia.
Nursing students at Fresno State are benefiting from some of the latest in technology to help them learn their skills.
I don't feel like I can quite catch my breath either.
We are in the simulation lab where students work on state-of-the-art mannequins, patients that are designed to simulate real symptoms, real health issues.
The simulation lab in nursing is an educational tool, and because much of what we're doing is high risk, we want to make sure that our students have the opportunity to practice and practice before they actually start working on a patient.
Nursing students like 21-year-old Amy Baldwin spend time in the sim lab. This semester, she also spends 2 days a week at a local hospital. Amy says being able to make her mistakes in the lab and learn from them are invaluable experiences.
When we're at the hospital, we don't have the time to get our mistakes or even ways we can improve broken down for us, whereas where we're in here in the simulation lab and we have the patient that talks to us and our instructors here with us, we get the experience and the nerves out by feeling like we're performing with a real patient.
It is all excellent training for these nursing students, but both are in controlled settings, either in the classroom or hospital. Fresno State professor Kathleen Rendell has led the effort to get students out into the community.
When a patient's in a hospital, they're in the nursing environment. So the student nurse and the nurses have control over the patient. When the student goes out into the community, the patient has control over their environment. So the student has to adjust how they're going to work with that patient to provide care for them.
Since 2013, Rendell has been running the Mobile Health Unit, a clinic on wheels owned by the Fresno County Office of Education. She uses it to go out into the community to serve patients and teach students.
How are your normal blood pressures?
It could be anything. I did take my medicine today.
Nursing students provide the medical care, doing basic preventative exams, like taking blood pressure, screening for diabetes, high cholesterol. Conditions that, if go unchecked, can lead to serious health problems.
It's actually really eye-opening because it's a lot different from, in the hospital setting where you see patients all the time and some of them are really into their health and they keep up, but whereas in the mobile health, we see patients that don't even know that they have like diabetes or high cholesterol.
65-year-old Nina Meyer says the benefits of having the mobile unit out into the community are helping her better take care of herself.
One, that is easily accessible. Two, when you're low income, it's very difficult to afford all the medical costs. So this helps me out greatly.
Rendell says in some of the rural communities, the mobile health unit may be the only way some residents receive preventative care. Traveling to places like Orange Cove or Cantua Creek, students see a different kind of patient.
We actually get to see the struggles that the patients are going through. Some of them don't have health insurance, some of them don't speak English, and they have a harder time communicating with doctors when they're at a clinic. And in classroom it's just reading, but here we're actually interacting with the patient and experiencing more of what they're going through.
Students from different health disciplines now travel with the mobile unit. Annabelle Galindo is studying dietetics. She can help with nutrition. Physical therapy students can check for muscle issues. It teaches those in the medical professions the importance of working together.
I have a better understanding of what they do and how we can all bring our knowledge together to better help patients.
Rendell says it is important for nursing students to have a better understanding of the community they serve. the different cultural backgrounds of patients. She wants them to know giving back to the community is important.
I just feel it's so important to give back to individuals. I mean, everybody has a right to feel healthy, in my mind, and I don't know. It just makes me feel good being able to help somebody have access to care.
Now, Dr. Rendell says the number of times she can take the mobile unit out in the community is totally dependent upon funding. She gets from grants and private donations.
So important. That hands-on experience is really invaluable.
Right. Labor of love for her, though.
Yeah, it sure sounds like it.
Yeah.
Juanita, thank you.